Good evening. We will continue talking about the symptoms, the main symptoms of peripheral vascular disease that usually affecting the lower limbs but might affect the upper limbs as well. We have discussed in the previous video the intermittent claudication and the character, site, what increases, what decreases the pain. Today we will talk about the rest pain. Rest pain is the second main symptom that the patient with peripheral vascular disease can get. And as we have mentioned, it usually affects the lower limbs more than the upper limbs. And it is a symptom that can indicate the patient has a threatened limb ischemia. So rest pain is a pain that will occur to the patient while he is at rest. So we have to analyze the pain in the same way. We have to ask about onset, course, duration, character, site, what increases, what decreases, if the patient pain is referred or not, and the severity of pain. Usually the rest pain is very severe. So the pathology of rest pain is the same like intermittent claudication, that actually there are some tissues during rest are not getting enough oxygen blood supply through the arteries to maintain aerobic respiration. And because of that, there will be anaerobic respiration in these tissues, which will end by accumulation of lactic acid and metabolites in the tissues. But because this patient is not doing any exercise, so the pain will occur in the farmost point from the heart, which is the toes and the forefoot. So when exactly does this happen? Usually this happens at night when the patient sleeps. As long as the patient is sitting or standing, the effect of gravity will drag more blood to his feet. And remember, we are talking about a patient who has severe peripheral vascular disease. Once the patient will start to lie down, so this effect of gravity will disappear. So the amount of blood going to the feet will get less and less. Through the sleep, the patient might wake up with severe pain in the toes or forefoot, awakening him up from his sleep. Sometimes the patient will not be able to go to sleep because of the pain in his toes. The second reason for the rest pain to occur that when the patient goes to sleep, he might cover his feet. Coverage of the feet will increase the local temperature, which will increase the basal metabolic rate of the skin, and this will cause cutaneous vasodilation. And then there will be more blood flowing from the deeper tissues to the skin, and this patient has already severe peripheral vascular disease. So the deeper tissue will get less amount of blood, and he will get anaerobic respiration in these tissues and the accumulation of metabolites. So according to this, we might expect that the character of the pain should be the same in rest pain like intermittent claudication. But remember, in intermittent claudication, the accumulation of lactic acid and metabolites occurs in flesh of muscle, while in the toes there is no flesh. This is why when the accumulation of metabolites occur in the toes, the patient will get severe stab pain. So the site will be the forefoot and the toes. The character will be stab severe pain. Usually you will see this patient if you are taking history from him or trying to examine him. If he is lying down for a while on the bed, on the examination bed, then after a while he either will start to sit down or he will start to put his leg down the affected side to get more blood because of the effect of gravity. So this patient actually in his home, he will actually tell you that he is getting better when he walks, or if he is putting his leg down, or if he sleeps in the chair because of the effect of the gravity. So the onset usually is gradual, and the character of the pain will be severe stabbing pain. The site will be the toes. What increases when the patient put his legs up or when he covers them, and what decreases the reverse of that once the patient uncovers his feet and put his leg down, and then the basal metabolic rate will drop, and then the oxygen supply will be enough to maintain aerobic respiration. Usually this pain is severe, it's not referred somewhere else. This pain usually when it happens and it occurs to the patient, it will be repeated every day. And this is one of the things that might affect the quality of life of the patient in a very bad way. And it's considered as a threatened limb ischemia, and this patient need to be treated as soon as possible.